Good evening, everyone. Thank you for joining us tonight. Our topic for Brain Matters is Brain Health Awareness Month, and we're looking at lifestyle factors and early detection. I would like to introduce our webinar team. I will be your host this evening and help through the PowerPoint that we have associated with this webinar to help guide us through it. And behind the scenes is Dr. Corinne Pettigrew, who is going to monitor the chat box for you in the question and answer period. So thank you, Corinne, for setting up the webinar logistics and for staffing that. And then we have our fabulous moderator, who you may remember from prior webinars videos, and that would be Mrs. JoAnn Scipio, who is with Delta Sigma Theta-Annapolis Alumni Chapter. Our webinar overview. This consists of a few different parts. There's going to be a presentation on brain health and lifestyle factors by Dr. Marilyn Albert, followed by sort of cameo interviews with the panelists and a couple of questions before we move into a group panel discussion. After that, there will be an opportunity for audience Q and answer. And now I give the webinar over to JoAnn Scipio to introduce our speaker this evening.
Thank you, everyone, for being here for this important webinar on brain health, lifestyle factors, and importance of early detection of dementia. We are very fortunate to have with us Dr. Marilyn Albert, who will give a short presentation on lifestyle factors that impact risk for cognitive decline. Dr. Albert is a professor of neurology and director of the Division of Cognitive Neuroscience in the Department of Neurology at the Johns Hopkins University School of Medicine. She is also director of Johns Hopkins Alzheimer's Disease Research Center. Her research is primarily focused on understanding the cognitive and brain changes associated with aging, as well as Alzheimer's disease and related disorders. This work uses biomarkers based on imaging, cerebral spinal fluid, and genetics to better understand the earliest phases of Alzheimer's. Her research also includes the study of risks and protective factors may have an impact on the progression of dementia. Dr. Albert, thank you for joining us today.
It's my great pleasure to be with you today. Let me bring up my slides so that we can have a conversation about lifestyle factors. Can you confirm that you can see my slides?
Yes.
Wonderful. Okay. Well, what I'm going to do, because we have a relatively short period of time, is to go over 4 lifestyle factors that have been gaining a lot of research, and there's a lot of information about it. And some of them are risk for cognitive decline or dementia, and some of them are protective. And I just wanted to begin by giving everybody a little bit of background on how this field of research has evolved over time. So many years ago, in the late 90s, there were a lot of large observational studies that were conducted in the community. And they were primarily designed to examine people who were cognitively normal, get information about them, about their lifestyle factors, how they managed every day. They were then followed over time. And then the researchers looked at the factors that seemed to predict preservation of cognitive function. And I have here on this slide just examples of the very large numbers of studies that were done years ago. And mostly what I'm trying to demonstrate by this slide is how they ranged across the world, really. There were a number of studies in the United States. There were studies in Canada, in Sweden, in Germany, in the Netherlands. And they all were designed in this very similar way, to look for lifestyle factors that might be protective or might increase risk. And over time, what became clear was that there were at least 3 areas where there was a lot of agreement. And that had to do with the area of mental activity and physical activity and vascular risks. Now, in these studies, people were just asked to report what they were doing. So there wasn't a lot of measurement about things. But so, for example, with respect to mental activity, people were asked about their level of education, whether or not they read books, whether or not they did crossword puzzles, played board games. With respect to physical activity, they were asked about how often they walked, they went up and down stairs, they played sports. And then with respect to vascular risk factors, they were asked about whether or not they had high blood pressure, high cholesterol, diabetes, smoking, or whether or not they were overweight. And the bulk of all the information that was gathered from these many large studies was that these three areas really seemed to be important. That people who were more mentally active were more likely to maintain cognitive function over time, that people who were more physically active likewise were likely to maintain cognitive function over time, but that vascular risks, the ones that I have listed here, were associated with an increased risk of cognitive decline. And while these studies were very important, they are only observational studies, and there are risks from using that kind of data, because it might be that there are innate differences between people throughout their lives and so what's considered in the field looking at what are called randomized clinical trials. And what that means is that a group of people expose them to this risk, we don't, and we look at whether or not there are associations with people who were exposed to this factor versus the ones who weren't. And that's what I'm going to try to describe very briefly to you from these various areas. So the first is cognitive training and maintenance of mental abilities. And the major study in this area that has persuaded everybody that being more active is cognitively active is beneficial is a study called ACTIVE. That stands for Advanced Cognitive Training for Independent and Vital Elderly. It contained almost over 2,800 people. The population was actually quite diverse. And primarily what they did was they exposed people to different kinds of cognitive training. Then there was a group that didn't get that kind of training, and they looked 5 years later and 10 years later to see what the outcomes were. And this slide summarizes what they found. The line on the bottom is the control group, the people who didn't get exposed to the training. The various lines on the top are the ones who did get the various kinds of training, which were memory and reasoning and speed. And what you can see is that 10 years later, the people who had this cognitive training were not only doing better in those areas, but they were actually doing better in daily life. These were, how well you can manage on a day-to-day basis, how independent you are. So this was a very impressive finding that impressed everybody, because it suggested that even though the training was reasonably short, it was just a few months, 10 years later, you would have this big impact. So the summary from the work in this area is that cognitive training can, of course, improve your performance on specific tasks, but more importantly, it can have long-lasting benefits in everyday activities. And right now, people are following up this cohort 20 years later to see whether or not these benefits actually influence the risk of dementia. Are devices that can measure physical activity. They're called accelerometers. And one very large study included 78,000 participants. And what they found was that people who had 4,000 steps a day had a 25% reduced risk of dementia. And people who had 10,000 steps a day had a 50% reduced risk of dementia. Moreover, it wasn't just the number of steps you had every day, but it was the intensity of the activity. And so this particular study that I'm talking about suggested that moderate intensity was better than lower intensity, and that moderate intensity activity was associated with the lowest risk of dementia. So the conclusion that you can make so far from these studies is that physical activity, of course, is beneficial for all aspects of health. It reduces blood pressure, it reduces anxiety, it reduces sleep. But so far, the evidence suggests that moderate intensity activity appears to be beneficial for cognition, and particularly if it's not just low intensity, but things that involve aerobic activity and stretching. What's going on now in the field is that there are a number of studies, some of them randomized clinical trials, trying to look at how brain structure and function are altered, how cognition is altered, what's happening at the molecular level, to try to understand exactly what's going on. Because if we can understand the mechanisms, then we can better develop interventions. What about vascular risk? So similar to mental activity and physical activity, there was an enormous amount of data suggesting that vascular risks increased cognitive decline. And as I said before, this included high blood pressure, diabetes, cholesterol, being overweight, and smoking. And one of the major studies that found this is a study called JHADRC. It stands for atherosclerosis in communities. And this is an example of their findings. They found that midlife hypertension, people at midlife who had high blood pressure, had a 39% increased risk of dementia 25 years later. And similarly, midlife diabetes was associated with a 77% increase in dementia risk over 25 years. So that's really impressive and suggests that it's important that we should control vascular risks. One of the challenges in this field has been to conduct randomized clinical trials where these factors are controlled, and then you look to see if it benefits cognition. And the major study in this area is a study called SPRINT-MIND, where they took people 50 and older who had hypertension, and some of them had very intensive control of hypertension and some less intensive control. And as you can see from this slide, several years later, there was a 19% decrease in the risk of mild cognitive impairment and a 17% decrease in risk of dementia. The risk of dementia was not significant in this analysis, and people think it's because they stopped the study early, but at least we know that this had a big impact on risk of mild cognitive impairment. And so we know that many observational studies show this association, and it's the SPRINT-MIND study that's been most effective in demonstrating that if you control these risks, you actually have benefits of cognition. And the last area that I wanted to mention, I didn't talk about earlier, it has to do with hearing and maintenance of mental abilities. This is an area that's gotten more recent attention, and it's because there were a number of observational studies that suggested that if people had moderate to severe hearing loss, they were more at risk for cognitive decline. And the big study in this area that has suggested that there are benefits from treating hearing loss is a study called the ACHIEVE study. And was relatively recently conducted. They had a very large sample of people 70 to 84, and they had in-person sessions where they gave people hearing aids. They counseled them about how to use it. They did cognitive testing, they did brain MRI, and then there was a control condition where people just had general health education. And the primary findings from the study is that overall in the sample, there were not benefits in cognition, but there was a subset of participants that had significant benefits. So these were people who had been in this JHADRC study for many years. They had a number of risk factors, much more, so they were less healthy than the new people that volunteered. They were called the de novo group. And the people who had been in the JHADRC study had a 48% reduction in cognitive decline. So the ACHIEVE study suggests that hearing aid, particularly in people who have risk factors, showed cognitive benefits. And now what's happening is that there's a longer term follow-up of this cohort to see whether or not in the other group that was more healthy, if they would benefit, and then looking at all kinds of things like brain structure and health-related quality of life and healthcare costs. So overall, what we've learned from this work is that there are multiple factors that predict maintenance of cognitive function over time. And the evidence suggests, although it's not totally, confirmed, that a combination of these factors is more effective than one of them alone. And so this is a really important area of study. Many people are trying to look at it and identify exactly what we want to do on a day-to-day basis. Increase our rates of maintenance of cognitive function, of course, behavior modifications, some people are trying to figure that out. I would just say on this slide that this is an area of significant obligations. So there are a number of things that people can meet and source of information. One of the reports, which have been published so far in 2017 and 2020. And then the Global Council on Brain Health has a lot of information on their website, and I have a link to that here on this slide. So it's a great pleasure to talk to you about this afternoon. I think that there'll be an opportunity to answer questions later on, and I look forward to hearing people's thoughts about this topic.
Thank you for that great talk, Dr. Albert. And we have a few questions for you now. And for the audience, if you have additional questions, would you please either put them in the chat or in the Q&A? Dr. Albert, our first question, what types of future studies are needed to further understand how lifestyle factors impact an individual's risk of memory loss and dementia?
I think there are really two different types of studies. So one are studies that are going on now, where people are combining these lifestyle factors together. I said that the evidence suggests that in combination, they're more effective. And so right now there's this big study called the finger study, another study called the pointer study, where people are combining these things together to see whether or not they can demonstrate that in combination, they're more effective. But the other kinds of studies are ones that are going to be very carefully focused, very small ones, where people are trying to understand the mechanisms of what's going on. Because if we can understand that, then we can better design interventions.
Thank you. Another question, why are biomarkers such as brain imaging and measures from blood so important for understanding changes in brain health?
So I was mentioning that in these studies, they often do things like measuring brain structure with MRI. And the best example is the study that I just mentioned, the ACHIEVE study, where they had hearing aids. So it looked as if cognition was benefited. It looked as if it was benefited in a subgroup, but they actually have also looked at MRI. And they can see that the brains of these people who had hearing aids had less shrinkage in them. So that convinces us more that these interventions are beneficial. So these biomarkers like imaging provide extra additive information, but they also help us understand something about mechanisms. And that's why they're going to be increasingly used in these kinds of studies in the future.
That's amazing, Dr. Albert. Who biomarkers could reveal so much information? That underscores
and more and more, we're going to have blood biomarkers. Of course, we have imaging, which is really valuable. So there are all kinds of ways in which we can learn about the brain and link that to these lifestyle factors.
Very good. This underscores the importance of research and discovery. Okay, let's meet our additional panelists. Dr. Hernandez is an internist and geriatrician at Kaiser-Permanente in the Baltimore region. Dr. Hernandez works as a primary care doctor, Kaiser-Permanente's Abington office. And he works in memory care program in Lutherville, which encompasses evaluation, diagnosis, and treating patients with dementia. Dr. Hernandez is a life care planning champion at Kaiser, where he leads Baltimore initiatives in education and improving workflows around advanced directives and palliative care. In 2022, he completed Harvard's palliative care education and practice program. Dr. Hernandez is a preceptor of students in their primary care rotation with the University of Maryland. Dr. Hernandez's internal medical residency was at Christiana Healthcare, and his geriatric fellowship was at the University of Pennsylvania. Dr. Hernandez, questions for you. Why is it important to talk to your doctor if you have concerns about changes in memory?
Absolutely. Thank you so much. Wonderful talk, Dr. Albert. Thank you so much. I'm you know, as you had mentioned, JoAnn, I'm a primary care doctor, and I also work in our memory care program. I'm a primary care doctor at heart. I was actually also a National Service Corps scholar before working for Kaiser and working on underserved area in Baltimore. And prevention is such a key. And Dr. Albert, this talk was amazing. Thank you so much. And why is it so important? Because knowledge is power. I give the example as in heart disease and cancer. It's important to diagnose it and detect it early in the stages versus later in the stages, right? And we know there are modifiable risk factors that can increase the risk of dementia and further the decline. And some of those basics, starting from the top, is vision. What you see is what you get. Many seniors that I see, both in primary care and our memory care program, suffer with vision issues, untreated cataracts, and that can definitely impact quality of life. Another one is hearing, as we talked about, as Dr. Albert had talked about in her studies. Getting your hearing checked. There are so many seniors that I see, hey, I think I have issues with my memory. I can't really hear well. I'm not really sure what's going on. And I look in their ears and they're full of wax. And just having that simple treatment can be make a huge difference. And then getting your hearing checked. And I know sometimes hearing aids can be very expensive, but even getting a pocket talker would be cost effective, which is basically a sound amplifier. And I know some of the over-the-counter hearing aids have better tech, and something's better than nothing. And we know that this is from MoCA Cognition Test, which is the website that the standardized test, the Montreal Cognitive Assessment Test. Worsening hearing can increase risk of dementia by 15%. Both vision and hearing loss combined can increase the risk of dementia by 90%. So that's so important. And the teaching that I always say is, especially with why it's important to ask about these problems, we could do something about it. And the teaching that I always preach is whatever's good for the heart's good for the brain. So that's exercising, eating healthy, and keeping mentally active. A lot of what Dr. Albert had talked about.
Thank you, Dr. Hernandez. Another question we have for you: why is it important to diagnose dementia early?
That's a great question. It's all about planning for the future. And I give the example of like one plans for retirement. It's best to plan early, right, rather than later, or even investing in your if you have a young child, investing in your kids' college education. Best to do it, early. And also, too, what I always have, because people are afraid of this, sometimes afraid of this diagnosis, losing control. But what I say about the disease is that it doesn't change on how much you love people or how much people love you, but it helps us focus on safety. Okay. Making them aware of the diagnosis and some of the safety risk factors. Okay, one of the biggest one that I see, unfortunately, is with somebody with Alzheimer's, dementia, they are increased, or any type of dementia, there are increased risk of financial abuse. This is something that doesn't get talked about, that's why I wanted to mention it. And having protections around that person. Okay, driving is, and then with that is that having documents in place, like both the medical power of attorney is very important. Who's your advocate if you can no longer make decisions for yourself, and then also the financial power of attorney as well, as I mentioned. Other thing that I think is very important, why it's important, is to be just aware with safety around driving. Okay, And early diagnosis is helpful in engaging family members. We know that this is not just my grandma getting, older and having pathologic brain disease. And it takes a village to I say it takes a village to raise a child. It takes a village to care for somebody with dementia. And it's helpful to know early so we can engage family members. And number two, one of the things I want to mention from what I first mentioned is that there are things that we can intervene on. Which includes, if they're having issues with hearing, intervening with that, and vision, promoting exercise. I will give a clinical example. I had a patient who was early in her 70s. She was living alone. She was smoking, very little socialization during COVID, and eating fast food almost daily. She had significant short-term cognitive issues, no longer able to live alone. Her Montreal cognitive score was about an 18 out of 30. By the way, it's at 26 and above is normal. So some significant decline. And then as we brought up this concern about her cognition, we got her help in the home. She ended up moving in with her daughter, multi-generational, living in the house. She's eating now from her garden that she has outside. She's no longer eating fried food. She's no longer smoking, goes to a senior center daily, and going on field trips. And I saw her 2 or 3 years later. She didn't want to come in. I said, hey, we should bring you in. And then her MoCA increased from 26 to 30. So just the power of keeping engaged, exercise, both mental and physical activity can be so powerful. So.
Okay, one other question. What are some of the risk factors for developing Alzheimer's?
Some of the ones we talked about, already, and a lot of them include the low-hanging fruit is, hearing and vision, and also blood pressure. Dr. Albert brought up the Sprint Mind trial. Keeping your blood pressure controlled can have significant impact on decreasing risk of dementia. If someone were to tell me, but by almost 15%, if someone told me you would increase my financial portfolio by 15%, sign me up, right? So limiting alcohol use, very powerful. Preventing obesity, okay? And then what Dr. Albert said is that diabetes, that's amazing statistic about midlife diagnosis of diabetes can increase one's risk of dementia by 75%. So lifestyle there's many lifestyle factors that can increase risk of dementia, as I just mentioned. So, and then smoking as well.
Okay, thank you, Dr. Hernandez, for making those important points. Also joining us is Teriko R. Epps, who grew up in Baltimore City. She is the principal and primary interior designer of Expressions of You. Additionally, Teriko serves on the Johns Hopkins Memory and Aging Community Advisory Board, which is instrumental in educating people on the issues surrounding dementia and Alzheimer's disease. Although she is not a healthcare professional, she gained valuable insight and skills as a caregiver for her mom. And she serves as a caregiver coach to encourage and support individuals who find themselves thrust into caregiving for their loved ones. Out of her caregiving experience, Teriko authored the book, Lessons Mother Taught Me in Spite of Alzheimer's, and it's now available on Amazon. In short, it's easy to read and has applicable lessons that are shared to help navigate and ease tensions through the arduous caregiving journey. Okay, Teriko, questions for you. Based on your caregiving experience with your mom, could you share your insights about the importance of early diagnosis of memory loss?
Thank you, JoAnn. And I also wanted to, I always love to hear the new research results from Dr. Albert. And it's very encouraging based on when I was caring for my mom, how far the research has come along. So that's always great news. And I love to share when I get this news. And I also thought Dr. Hernandez's points were powerful, and the examples really help, express and bring the points home. So thank you both for those things. In terms of caring for my mom as a caregiver and early detection, when we got early detection, well, as a daughter, and paying attention to my mother, I saw changes in her personality. I saw how forgetful she was getting. I saw her making big notes to herself. I saw her cleanliness and her hygiene changes. So because I noticed these changes, I insisted that she get tested. Of course, she was not happy about my insistence, but I did anyway. And so as a result of that, we were able to get diagnosed early, and that allowed her to have input into how she wanted all of her business handled as she declined in the illness. And so that was powerful because it gave her power to decide who she wanted to help take care of things, just put everything in place. So from that perspective, she was also able to tell her friends and her loved ones when she wanted to share what was going on with her. So that put her in control, which was, I think, a very powerful move for her. When you get a diagnosis like this, that you kind of know what the end result is. And I say you kind of know because her mother had it. So, and she helped care for her mother. So you kind of have an idea of what's going to happen in your life. So having the power to take some charge in that was helpful to her, I think, emotionally. Also, it allowed her to get on meds early, which helped retard the progression of the disease. So I know when we would go and visit her neurologist, she was always impressed with the amount of physical activity that mother had that did not go along with, if you will, the mental ability. It superseded it, if you will. And I'm not a doctor, but I kind of attributed that to getting her on medication early. It also allowed us as family members to devise plans for her care, so that her changes were minimal. I did move her in with me early on so that she could adapt to a new living environment. And I found in my caregiving coaching, when people kind of move someone later in life, or later in the progression of the disease, there are a lot more issues, if you will, because the person is not able to adjust, I'll say, as readily. It also allowed us to start her in a daycare that had special care for people with dementia and Alzheimer's. So it allowed her to get acclimated in that environment, which was helpful as her disease progressed, that she went along without having any kind of attitude or negative behavior around that. So those are some of the reasons I think that early detection is critical. And I encourage, when I give talks, I encourage whether it's spouses or children to kind of pay close attention and to not kind of ignore or minimize any changes in behavior that they observe in their loved ones.
Thank you. Another question we'd like to ask you is, a few years back, you and your mother were involved in a caregiving research study. What were the reasons you and your mom got involved in that study?
Because I was desperate. It's caregiving caregiving period, I think can be taxing, but caregiving with someone that has a mental deficiency is even more taxing, because they can't communicate what their needs are or be able to express themselves. So being desperate for help, being overwhelmed by the experience, made me reach out to whatever resources I could find. And at that time, there were much less resources than there are now. And so I'm happy about that. And that kind of encourages me to stay involved, because as I learn more, I provide more information, when I'm talking to people. So it's been very helpful. But basically, that's what kind of the need, the desperation was what encouraged me to reach out. Even, I did a study. I got involved in the caregiving group, the Alzheimer's support groups. So those kinds of things, because caregivers I say that you can't do it in a vacuum.
Okay. Tamika, you're remarkable. Thank you for sharing. We appreciate you sharing all of that. Our next panelist, Willie Powers, is also making a difference as a research participant. Willie is a caregiver for his mother, who was diagnosed with dementia in 2019. After noticing no remarkable improvement in his mother's cognitive skills and behavior as a result of taking medications, Willie felt science needed help to discover what causes dementia as well as a cure for dementia. So in 2023, Willie volunteered as a participant in Virginia Tech's CareX research project. CareX project plans to interview 360 caregivers by 2025, and the findings will be used to develop more effective services and programs to support families, caregivers, enhance the quality of life of persons living with dementia. Willie was accepted as a participant in Johns Hopkins University BioCard study. The BioCard study seeks to predict the onset of symptoms of mild cognitive impairment among cognitively normal individuals. Willie has honorably served in the Federal Civil Service for 33 years, and he will retire in December 31, 2024. Yay, Willie. He earned his BA in political science from Virginia Tech and his MBA from Hood College. So Willie, with all of that, we'd like to ask you some questions. You're currently participating in the BioGuard study, which seeks to identify risk factors and brain measures associated with development of cognitive impairment among individuals with normal cognitive status. What motivated you to become a BioGuard study participant? Is it possible for Willie, can you reply in the chat, Willie? Or if it's possible for one of the phone numbers on the invitation, if you could just dial in and maybe we could hear you that way. We can see you here, we'll hear you on the telephone. Let's give him a minute to do that, because he's got some good information, I'm sure, to share with us.
JoAnn, while he's dialing in, would you like to take a question from the audience?
Yeah, we have a question. Okay, somebody. Okay, my chat went away.
I can read it for you if you would like.
Okay.
The
Okay,
question for any of our panelists who would like to answer is essentially whether there are age restrictions on joining and getting involved in prevention activities. So for example, can a patient age 70 plus benefit from adopting new prevention activities and adopting new lifestyle factors that might help reduce their risk or manage symptoms?
So I guess I should answer that, Corinne, yes?
That would be great.
Okay. So I went over everything really quickly, but if you were looking at those slides that I presented, you would have noticed that most of the studies where they have shown that interventions made a difference included people 65 and over. And, for instance, the active study that did cognitive training, it was 65 and over. The Achieve study that was hearing loss, it was 70 and over. So there's lots of reason to believe that interventions that, among people who are 70 and maybe 80 can be very effective. So lots of reasons to change your lifestyle, even if you haven't been doing optimally until now. As I said, behavior change is hard. We know that. We know that it's easy to say, I'm going to get out and walk every day, or I'm going to go and get my hearing checked. But if you can really appreciate the difference it might make, I hope that will motivate people to make a change in their lives.
Okay, thank you, Dr. Albert. Willie, are you with us? Can we hear Willie now? Corinne,
I think
were
he
you
might
able
have
to?
signed off to try to come back. Oh, he's here.
Okay,
But he turned his video off probably to try and dial in. I don't see him yet.
he said unfortunately, no.
Okay.
Okay, I'm gonna throw this question out to Dr. Hernandez. What can you talk about some of the different types of dementia? People often use Alzheimer's and dementia, synonymously when that's not necessarily so. Could you kind of talk a little bit about that?
Absolutely, absolutely. So, yeah, I get this question a lot because, yeah, you said, yeah, I think, Alzheimer's is worse than dementia, and those type of things. And so, what I try to say is that dementia is an umbrella term. Dementia is an umbrella term that means that there's issues with your cognitive function that affects your activities of your daily living. And I give the analogy of it's like saying you have a car, but what type of car it is. Okay. So Alzheimer's dementia is a type of dementia. Okay, just like so that's the analogy that I give. So dementia is the umbrella term, and there's different types of dementia. Alzheimer's is number one. That's 50 to 80% of all dementias worldwide. There's a 5% chance of developing at the age of 65. That doubles every 5 years. So by the time someone's 85, that's 50% chance. Then there's vascular dementia, which is about 20 to 25%. And then those are a little bit less rare. Parkinson's dementia, Lewy body dementia, frontal temporal dementia. I see Willie just popped up, so I'll leave it as that. Thank you.
Okay, Willie's joining us again, so let's see how we can do. Can we hear? Can you say something, Willie, so we know?
Yeah. Are we clear?
Go ahead. Question, and maybe you can answer that. Okay, I did ask you about the BioCard study, so if you could answer that question.
Absolutely. Am I clear now?
Yes.
Okay, perfect. Thank you. And thank you to Johns Hopkins for inviting me. This is so important. Ms. Epps, during your entire presentation, I was nodding yes. I can empathize with everything you've gone through and your experiences. So I joined the BioCard study because of my mom. My mom was a school teacher for 30 years, actually on Biddle Street, which is near Johns Hopkins, a school teacher for over 30 years. And she had so many hopes, so many plans for retirement, and she's not enjoying retirement now. So for everyone in the audience, just imagine, again, you're working, putting in long days, probably some unusual hours. You have hopes and plans for retirement. And just imagine you having dementia and not enjoying retirement as you have planned. So I joined the BioCard study for my mom. And then my other motivation was I want to help find the cause and the cure for dementia. And science needs a little help.
Okay, thank you for that. What was the experience of being a research volunteer been like? We want to encourage people to get involved in research. So if you could share some of the experiences that you had being involved in research, that might help our participants.
Yes, great question. The BioCard researchers, they have been tremendous, super friendly, super empathetic to what my mom is going through. They explain they explain the process of every study before you even start the study, even before you arrive in Baltimore. And the other thing I'd like to impart is, as a participant, you're in control. You decide what studies you want to attend, what studies you want to participate in, and what studies you don't want to participate in. There was one study I did decline, but on the other hand, I did decide, I made the decision that after I die, Hopkins will get my brain. So I've completed all of the logistics. I've paid for my funeral just because this research is so important to me. I really want us to find the cause of dementia and a cure for dementia.
Very good. Do we have any Okay, what types of, do you recommend that other people consider participating in research, and particularly people of color? Because I know we're not involved in research as much as necessary. So how can we encourage people to participate?
Yeah, absolutely. I've been chatting with my colleagues, chatting with my family and friends. I've been a huge advocate of the BioCard study. And in addition to telling them or sharing my experiences with the BioCard study, I also let people know I have a phobia with needles. I do not like needles. And as an example, I think right before COVID, I visited Hopkins for a PSA test, for lab work for a PSA. I was feeling good, walked into the hospital, they sat me in the chair, put the little arm down. Last thing I remember was the nurse looking at me saying, "You don't look so good." I woke up, 4 people around me with an ice pack on the back of my neck. So even with that phobia, I'm 56 years old. I still have a phobia with needles, but I show up for the study because it means that important to me. That it's that important to me, and I tell people, share that story with folks when I'm advocating for research.
Thank you. Do we have? I'm not seeing any questions in the chat. Are there other questions? Okay, let's
I'd
go
like to
on
add, if I might, JoAnn, before about that question, because when I talk to people, I do encourage our community, because the numbers for Alzheimer's and dementia are higher in the African American community and the Hispanic community. So when I talk to people, I do encourage participation in studies, and I let them know, I call it a cocktail, like we've got a cocktail, but how do we know how well it's working if we're not participating to make sure that the cocktail has the right ingredients for the nuances among the different ethnicities? And so I think in some of my talks, I have encouraged people to, at least, put it in their thought process, decide to move forward and not hang on to the past, because of course in our community, there's some negativity about participating in researches because of things that have happened in the past. So I try to give them information that will allow them to rethink and participate.
Okay, thank you, Teriko. I see one question in the chat. It says, what are some of the things you do as a research participant? So people want to know what they get into if they sign up for that.
Okay, I guess this is addressed to me.
I guess either you or Teriko could answer that, since you both.
Okay. So my experience is, even before you arrive at Hopkins, the researchers walk you through the entire process. I was there for up to 2 days, and over the course of 2 days, before every test, the researcher would explain, well, here's the test, here's the process, here's what you might feel or experience. So over the course of 2 days, I had a physical, I had a cognitive test, I had 1 MRI, and I had 2 PET scans.
Okay, thank you. Okay.
I think Dr. Pettigrew might be able to have more information, but because there's so many ways that in research that people can participate in, some have, they don't require your blood or needles like Mr. Powers has experienced, and they follow you. So I think you can be as, I'll say active, and maybe that's not the right word, but in terms of how much of yourself you give, but as long as you commit to go throughout the process is, I think, very important.
So there'd be certain degrees of involvement based on the study. That's what you're saying.
Several studies, yes. Dr. Albert or Dr. Pettigrew can really, answer more to that, because there are ones that are more, invasive, and ones that are less. So as long as, I think, when people know what to expect, They know the process, they know what to expect, they know how much of them you need, and get the feedback. That helps the willingness in terms of them participating.
You're absolutely right, Teriko. You know, there are some studies, as you were suggesting, that people just are asked to complete paper and pencil kinds of assessments, and it doesn't involve having your blood drawn or having an MRI scan or anything like that. There are some studies that involve music therapy, you know, EEGs. It just depends on the study, and there are a whole range of them. On our Alzheimer's Center website, we try to describe as many of them as we can. But you're absolutely right that there's a wide variety, and people just should pick the thing that seems good for them and fits them. And I think what we've found over time is that once people have started to participate, they see that it's not quite so awful and scary, and hopefully they'll feel like Mr. Powers, that we're, you know, people are being treated well and everything's being explained. And so then over time, they're more likely to get involved in other studies, which is really great.
Okay. Let me see. Chat questions. Okay. So we'll move on to anybody on the panel. Do you have any things that I do have some more questions that I could throw out? I'm not seeing anything else in the chat. Let's see where we go. Corinne, are there any questions in the chat?
None additional at this time. I think maybe we could invite our panelists to provide some takeaway messages, if that works.
Yeah. So panelists, each one of you, if you could give us some takeaway point for individuals participating tonight. And we can start. And anybody want to start? We can start with Willie. Start with you. Takeaway.
So my takeaway is for the researchers, the providers, the scientists, we are cheering for you. The work you're doing is so important. You know, again, just imagine yourself on a field with millions of people cheering for you. That's what we're doing. I know the FDA is considering a drug to slow the progress of dementia. They've already approved it, they're about close to approving it. Again, I know change is incremental. We can do better. I really want to stress, I'm in this to help find the cause for dementia and a cure for dementia. And so to all the researchers, the scientists, we support you, we applaud you. You know, just do everything you can. You have lots of goodwill coming your way. And thank you so much.
Thank you very much for that, Willie. Teriko, do you have a takeaway you want to give to the folks?
I think my takeaway is for people to pay attention. I think people have the propensity to ignore signs that they see. So pay attention. And then when you see something different, you know, there's the little saying, see something, say something. Well, in this case, when you see something, do something. Go to the doctor with your loved one. Tell the doctor what you have observed, because your loved one will probably minimize, oh, you know, they don't know what they're talking about or whatever. But your information to the doctor will be critical in finding out what's going on. And it may not be dementia. It could be something as, quote, simple as a urinary tract infection or something that throws them off. But you got to find out. And then, because early detection, I think, is just key and critical.
Thank you, Teresa. I remember hearing something when you said about the urinary tract infection, and with my nursing students, we tell them, if I'm not me, check my pee, particularly for the elderly. Oh, that was a good one. That fits right in with that. Dr. Hernandez. I mean,
Yeah, absolutely. So first of all, thank you to our speaker, Dr. Albert, and our wonderful panelist, Ms. Epps. Just appreciate you sharing about your mother and your story. Both my parents had dementia, so that was very powerful. And to you, Mr. Powers, and what you had talked about research and even yourself, part of a study, and that's very powerful. Being a minority myself, that it is important to have underrepresented groups in studies. So I thought that was amazing. For me, it all goes back to me as a primary care doctor and also a geriatrician. A lot starts with prevention, and there's a lot we can do, as Dr. Albert had mentioned, about how many studies on lifestyle, on how we have the tools in front of our hands that we can really make a difference. And yes, there is research, and yes, there are up and coming meds, but there are some basic things that we can do to prevent, just like we can prevent heart disease and cancer. There's a lot of things we can do. So, and I always have that preaching, my take on whatever's good for the heart's good for the brain. Exercise, eating healthy, and keeping mentally active.
thank you, Dr. Hernandez. And Dr. Albert, what's your takeaway for this?
So I think what I want to communicate to people is that this is a really hopeful, exciting time in terms of trying to beat dementia and understand Alzheimer's disease. We think that Alzheimer's disease always existed. It was first described by Dr. Alzheimer in 1907, and when he did, everybody thought it was a rare disease. The current sort of modern era of Alzheimer's disease began about 40 years ago. And this year, we have a drug that's on the market that treats people. And just 2 days ago, there was another drug that was approved by an advisory committee. So it's kind of, a landmark time for many of us, seeing how much has been gained from all the work that everybody's done. And the only way we're going to continue to make progress is if everybody works together and everybody helps us and does their bit as best they can do, because we can see how much progress we've made. So there's lots of reason to be hopeful in the future.
Thank you. And it seems as though, that while this is a terrible disease, we can slow the progression of it. And that's the important thing with the early detection and everything, because often it's felt like we lose people with dementia, Alzheimer's, or whatever. We lose them twice. We lose them with the disease, the progression of the disease, and then when they eventually pass, we lose them a second time. And at this time, I'm going to turn right back over to Tony. Tony, I don't see anything else in the chat.
Okay. Excuse me. I just want to say what a fabulous webinar that was, and many thanks to the audience for joining us, and to our presenters, panelists, and moderator for sharing your knowledge on brain health, lifestyle factors, early detection, and research. What I'm taking away is the reality and the heart and the meaning that is put into these comments, and what a hopeful time this is right now. So thank you all. I also want to especially thank our steering committee, who brings you these webinars. And that consists of several representatives from many different sponsoring groups in the region. Thank you all very much for participating in this programming. And I want to let you know that in about a week or 10 days, the audience will receive a recording of the webinar and a summary of the main points and any resources that I can put together for you about brain health and tips for staying active, and things like the Global Council on Brain Health's 6 pillars of brain health. Also, please anticipate another webinar in the fall. I encourage you to reach out to our email and let us know what you'd like to hear about. We always want to make relevant programming happen. So thank you again so much, everyone. It's been a fabulous evening. Thank you for sharing it with us.